up your conversations and remember to write down something that stuck with you from this conversation, something that stuck with you, either something that made you fired up and upset about what we have, or hopeful about that vision of the future. If you could write that down on your Post-it and add it to our signal fire in the back. You're all such wonderful listeners for your groups. I know you're all wanting to pay attention to other people in your group and hear their stories. And again, this is the best part. But we need to move on to the next piece. So I need you to put your Post-its with your stories on the back, and then we are all going to come back together. All right, I invite you all to come back to your seats. So I know we all heard a lot of stories now. I'm sure we heard a lot of frustrations. I'm sure we heard a lot of pain. So I want to see some hands here from what you've all experienced. Raise your hand, throw your hand up. Oh, we're going to pause? Are we going to have a grand entrance? No. So throw your hands up. Who here has spent hours on the phone with insurance companies? Yes, right? Why do we do that? Okay, who has had your insurance company deny coverage for something your doctor said you needed? Mm-hmm. Who has had to change doctors because suddenly the person you've been seeing wasn't in network, or in my Medicaid people, covered by your MCO? Mm-hmm. Who has been forced to talk to an AI chatbot about healthcare instead of a person? Someone from my group was saying they keep saying representative on the phone over and over again. I got a trick for you, by the way, for insurance companies from my husband, who's an expert on this. The first time you get a helpful person on the phone, ask them to stay with you on the phone through transfers. That's my pro tip. Who feels like the system should just be easier? Like it should just be easier for us to get to the healthcare that we need? Yeah, I know we all do. Yeah. So how are we going to get there? One of the ways that we are going to get there, one of the ways that we organize to get there with the People's Lobby is by working with elected officials who understand where we are coming from and are fighting to make this system better. And so with that, I want to introduce to two of our incredible legislators here. I'm going to start with our state senator, Graciela Guzman. She is the state senator for this district that you are in right now, and she is my state senator. So pass this to her.
Oh my God. Hello. All right, when I say people, you say power. People. 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 Oh, it's so good to be in a church on a Friday with you all, man. I'm Graciela. I'm your state senator. I also happen to live just down the street. Sorry, allergies. It's a thing. Reflecting on I think two things I was asked to speak about, which is healthcare and organizing. So I'm going to take you back to the year of 1988, which is the year that my parents immigrated from El Salvador to LA. And then they met, it was super cute, and then I was born. And then my siblings, there's 5 of us in total, we all got to grow up on Medicaid, Medi-Cal in the state of California. I could tell you all about that. But fast forward, much of our childhood was spent looking at who in our own family and who in our community had access to healthcare and who didn't. And for our family, it was strictly on the sole basis of who had immigration status and who didn't. And for a lot of folks in our community and in my own family, that sole decision of like who got to be born where dictated who got to live and who got to die in my family. And so there's generations of people that should be here that died really, really painful deaths. And I say that because for the longest in my childhood, I didn't have a vocabulary for it. I just knew that it was really horrible. I knew that I really wanted my grandfather. I knew that I really wanted my grandmother. I knew that I really wanted my aunties, but like didn't really have anything for it besides the fury that you feel, right? So fast forward, I'm now in college. I'm getting to sit in an anthropology class for the first time, and they're teaching me what medical racism is, what disparities are, what policy is, how it interweaves. And so when I get to Chicago, where organizing is not just like how we do things, it is like how the city moves. And my experience with what I had grown up with and this like failure to have a vocabulary, but to have like a really real physical reaction to this is meeting a space where folks are saying, based on your zip code, you also get to maybe live or die in a very different way in Chicago, right? If you live in Englewood, if you live in Albany Park, if you live in Lincoln Park, if you live in Rogers Park, like all of those areas each have their own age disparity range. So for me, how I got to come of age here in Chicago was the signing up of thousands of people into the Affordable Care Act, right? It was getting to kind of be like the Paul Revere of healthcare for a little bit, if I could go there and be like, I promise healthcare's coming. I think Medicaid's coming for you. It's gonna be awesome. And then it kind of wasn't awesome. It was awesome to be able to look at some of our patients that desperately needed transportation, that desperately needed medical equipment, who I'm like, already you're doing horrible. But I promise I will tie this up in 30 seconds or so, which is to say that in the thousands of patients that I helped sign up, I saw the beauty of the promise of healthcare, but also the failure of the delivery, right? Which is to say that our stories are really, really powerful and how we connect with folks that right now across our state have really, really different experiences that all need to be heard. That all do have a place in policy because our policy can be robust and strong enough to catch all these people, but also that the organizing game has to be profound because healthcare is deeply personal, right? Who is here? How do I get to live? Who do you see me for? What am I good for? I've had patients tell me that. All of that is bound to our healthcare system that right now doesn't make people feel like they're a lot, but it should be the opposite. So I say that because the organizing and what we're doing here and figuring out what we want to talk about, how we want to talk about it, how we want to connect with each other, how do we create these really open, brave spaces to unpack healthcare, also create this momentum for what are we going to reimagine and re-envision in Springfield and in places like it where I sometimes talk about it as the place where imagination goes to die. Because we love it, but it likes to tell us no next year, or no, maybe this way. So the organizing has to exceed that place. And so I just want to ground us in why what you're doing is so important because healthcare is a human right. Healthcare is a human right. women rights. And if we're going to get there in a way that is inclusive of all of you here, of many people that wish they could be here but cannot be here, our organizing has to be like A++. So if you feel like you got something out of talking to your neighbor or out of the pod work that you think is going to elevate your organizing game, can you say, what up? What up? If your organizing team is going to level up, because we have to level up to the place where millions of Illinoisans have coverage that don't have it today, can you say, what? That is what we're building through people power. Thank you.
Wow. All right, I want to invite up our next legislator. We have Representative Lindsay LaPointe, one of our amazing allies with the People's Lobby, with whom we passed HB 1085 last year. Thank you, Allie. Thank you, the People's Lobby. And yes, we did pass HB 1085, which gets behavioral health professionals reimbursed more by commercial insurance so they can continue to take insurance so people can get access to mental health care. Thank you. All right, so I myself am a social worker turned state representative, and I used to do homeless street outreach up in Old Irving Park, Portage Park, and I did that work in 2012 before we expanded Medicaid. So, doctor, when you were talking about how the fact that childless adults, quote unquote, now have access to Medicaid and what a big deal that is, I was sitting there thinking about the homeless street outreach I used to do with childless adults and how they had zero access to Medicaid in 2012, which meant zero access to addiction treatment and mental health treatment that could be covered by insurance. And so even though we have an immense amount of work ahead of us and we have to protect Medicaid for quote unquote childless adults, we have made progress. And I want to touch on real quick the progress that we have made and have yet to make at the state level. Because it's so easy to think about Congress and Medicare for all on a national level, but there are things that we can and should and are doing at the state level. So I'm going to touch on a few of those things. At the state level, we can control what we do related to about 40% of everyone in Illinois on commercial insurance. It's called state-regulated commercial insurance. So when we make changes for commercial insurance, it's about 40% of all people that are on some type of commercial insurance. We also have so much leverage when it comes to Medicaid at the state level. Because that's a joint federal program, we make decisions about what the reimbursement rates are. We make decisions about what Medicaid covers. And this year, we just passed a package, and one of the things it does is make sure that Medicaid will cover telehealth for intensive outpatient treatment, because that wasn't covered before. And I almost forgot about that really important win. So, two other things. Something we did at the state level and something that is a behind-the-scenes implementation thing that's really important when it comes to Medicaid healthcare. So, a bill that we passed 3 years ago, if my math is correct, yes, seeks to expand access to behavioral health care, which means mental health, addiction, trauma treatment, harm reduction. And it can be difficult to do that if we don't have professionals in those roles that are getting compensated adequately. And we also need professionals who reflect the population of Illinois, not just the typical mental health professional, a white woman. Because guess what? The world is beyond white women. So we passed a bill in Illinois that created an alternative to the licensed clinical social worker exam. And we did that because data showed that the exam was racially and age biased. And since we passed that bill, there has been almost 1,000 people who now are fully licensed clinical social workers that can bill insurance and provide healthcare to people. Healthcare to people. That's a big deal. 1,000 new social workers. And the one other thing I'll say as I'm over time, this is a behind the scenes thing, and this is why we need scrappy legislators. This is all about Medicaid managed care. And I got a call 4 days ago from a mental health organization, some of you might know, Chicago Therapy Collective. They are our biggest mental health provider, providing targeted mental health to our LGBTQ community. And they had just been denied a contract with Meridian.
And Meridian, as you saw on the slide, is one of our today 5 Medicaid managed care organizations. So they needed help with somebody stepping in to call Meridian directly and say, why? Why did you do this? And I looked up the numbers, and that state Senate district where Chicago Therapy Collective is located, which anecdotally I think is probably the highest concentration of our LGBT community in the state. Andersonville, Boys Town, 7,000 something people are on Meridian. So it's not acceptable for Meridian to just say, nope, not doing it. So that's where we come in and we step in and advocate to Meridian, their lobbyists, to HFS to say that is not acceptable for you to just deny this contract. So we're going to continue to do that work, and everything you're doing to organize out front and behind the scenes is leading to more access to care. We have a huge fight ahead with pushing back on the harms coming from Washington and the loss of Medicaid, but we are here to fight that fight with you.
Thank you so much, Representative LaPointe and Senator Graciela Guzman, who is my senator, and really happy to hear what she had to say tonight. So hello, everybody. Is it getting cooler, or am I just hallucinating? Okay, wasn't sure. You're all hanging in there. You look great. So my name is Nikki Nash. I use she, they pronouns. I am a volunteer leader in the healthcare task force of the People's Lobby. Yeah. And I identify as, among other things, a Texan. But after 46 years of living in Texas, I moved to Chicago in the winter of 2024. Texas and I need a break. And I am so happy to live here, and I'm happy to have found the People's Lobby in which to make my political home. Yeah. When I moved here to Illinois, I wanted to change how I engage with politics. With the People's Lobby, I have met both my state senator and my state representative, and several other senators and representatives to discuss and promote legislation that is important to me. I've helped plan 2 trips to Springfield during the spring session so that I, along with over 100 other volunteer members, could make our voices heard at the Capitol. I've gone to tremendously useful trainings, educational events like this, and even some parties where I've met so many fantastic people. And I am proud to be in this community of thoughtful, caring, determined humans, such as you have heard from tonight, and there's many more. So I want to talk to you about something we do to hold ourselves accountable to accomplishing goals like dignified universal health care for all is by committing to ourselves and to each other to take action. We use a simple form, or what we call a commitment card. Our lives are busy and complicated. I know mine is, and everyone else I know. But we use this tool to declare what we want to prioritize for ourselves and our community to the best of our ability. This is how you take what you've heard and seen tonight and what you felt this evening, and you turn it into action. So I am personally inviting you to participate in the commitment card. You can scan the QR code. There should be a sheet where you're sitting. If you would like a paper copy, please raise your hand and someone will bring you one. And I'm going to talk you through what is on that commitment card real quick. So if you do the honors here. Okay. It's coming on. Well, people can grab those QR codes. You're not sure how to do that, I bet your neighbor does. Okay, and I'll just tell you real quick what's going on with these commitment cards. So first up, you'll see on there that we're holding an event called How Our State Can Lead the Resistance, an Illinois Budget Debrief Town Hall. Woo! If tonight's discussion has you wondering about how to pay for the health care we need or any other social service that requires funding, this event will be a good fit for you. And here is my, and maybe yours, Representative Will Guzzardi, with a few more words about it.
Thank you. Good evening, everybody. Good evening, everybody. Yeah, all right. Welcome to the 39th Legislative District. I know you guys, when you crossed the border, you felt like a certain kind of good vibe. You didn't know why. You entered the 39th House District. That's what happened. I'll be really brief about this event. So raise your hand if you're on Medicaid in this room. Medicaid. Any Medicaid patients in this room? Anybody know a person who's on Medicaid? Anybody know if people on Medicaid have ever had a hard time finding a provider? Yeah, right? The reason is the state doesn't pay them. The state doesn't pay doctors to cover Medicaid patients. Our reimbursement rates are too low, and so doctors say, I just want to see private pay patients. I don't want to see Medicaid patients. And that's wrong. So the reason I tell you this is because the struggle for healthcare is intimately bound up with the state budget. Where does our money come from, and where does it go? And how are we going to tax the rich and the biggest corporations in the state to fund Medicaid, to fund healthcare, to fund social services for everyone? So if that question seems interesting to you, where the hell does our $56 billion budget come from? And why aren't we spending more on Medicaid to help people get covered? If that seems like an interesting question you want to learn more about, come join us Saturday the 20th at Schurz High School right on Milwaukee and Edison, just a short drive from here or short trip on the CTA. It's going to be a great event. We're going to talk about what happened in this spring's legislative session, get into the details of how the budget works, and how we can fight for a better and more fair budget. Thank you, guys.
Thank you so much for that. I will definitely be there and hope to see some of you there as well. Just want to give a shout out to the rep too for riding his bike here. That was really cool. So the next event listed on the card is political education, Medicaid, power, and universal health care. So this is a session you can attend to learn more about our healthcare system and what it will take to change this. If you're like me and still get Medicaid and Medicare confused, come to this session and there's no shame there. We will be here at St. Luke's. It'll be in July. We don't have the date and time, but if you click that box, we will make sure you hear the details when they're ready. Oh, that's a great point. Thank you, Mary Margaret. Yes. Third, you will see the People's Lobby monthly healthcare task force meeting on Tuesday, July 7th, 6:30 to 8 p.m. This is a Zoom link. There's people from all over Chicagoland and beyond that join us, and you are all welcome to join us. I'm sorry, the electeds can't come, but everyone else can come. I'm sorry, you can have your own party. We talk about a lot of things. We do a lot of planning, and we would love to hear your voice in that. If you check that box to register, you will receive the Zoom link. And then fourth on this section, I want to invite you to contribute financially. This is the weird part where I ask people for money. But I will do it because of how much I believe in what we're doing here at the People's Lobby. We have over a dozen amazing staff. Shout out to any staff here tonight. We drive people to Springfield, and we always bring lunch. We get to have good food at events like this. We engage in the work of tearing down the pillars of authoritarianism and cause actual financial damage to corporations that get in our fucking way of the world that we deserve. So, things like that. We want to be independent. We are and will continue to be independent from the ultra wealthy and the political parties. The more our funding comes from the people, the more we can use that money to build the world we all deserve. There's a place for everyone in the movement. For some people, it's giving time, and that's great. For others, contributing money, even if it's just a little bit, is what they have space for. So I want to invite you to consider joining our shared work in that way today. Yes. Say again. Cut the rest. Let people do the rest. Okay. Sorry. Hannah's the boss here. I don't think we've heard from Hannah much tonight, and just want to say thank you, Hannah, and great job. So check out the rest of the card. You can tell us if you want to get in touch. You can give us feedback. That's how we grow. Please do fill out the card, even if it's just a tiny piece of it, because we want to stay in touch and continue this conversation. Please submit it when you're ready, and those of you who have paper copies, we'll grab them from you soon. And we are going to wrap it up, and I will turn it back to our fabulous MC, Cherie, to wind it up for us. Thank you very much.
Okay, we have come to basically the end of our program. First, thank you for being here, for caring about your neighbor enough to organize and figure out how do we get the healthcare that we need. I want to remind folks that after this is over, we still have downstairs, we have resources, art, food, and community. If you want to continue the conversation, you can go to the large classroom to share your story with someone who is there and ready to listen. Also, feel free to catch one of the organizers in the back to schedule a one-on-one. So to invite folks to leave, and we invite folks to leave. There will be some more thinking. We invite folks to join in or leave while it is going on. Again, thank you for being here. Thank you for caring about your neighbor. And I hope that when you leave here, that you feel more powerful than when you
You gotta put one foot in front of the other and lead with love. Put one foot in front of the other and lead with love. You gotta put one foot in front of the other and lead with love. Put one foot in front of the other and lead with love. You gotta put one foot in front of the other and lead with love. Put one foot in front of the other. Don't give up hope. You're not alone. Don't you give up. Keep moving on.
Lift up your eyes, don't you despair. Look up ahead, the path is there. I know you're scared, and I'm scared too. But here I am, right next to you.
And lead with love. Put one foot in front of the other and lead with love. Lead with love. And lead with love. One more time. Lead with love. Thanks, everyone.
so much for being here. I'm Rose Mativier, Chief Operations Officer and practicing therapist here at Midwest Counseling and Diagnostics. We are so pleased today to host the advocates, organizers, and legislators who made HB 1085 possible. We want to express enormous gratitude for Representative Lindsay LaPointe and State Senator Karina Villa for championing this bill. To the People's Lobby for their relentless organizing. And to the wide coalition of legislators who voted yes, demonstrating strong bipartisan support for these needed changes. As a provider and administrator in clinical practice for the past 20 years, I have seen every day what underfunding and underpayment in behavioral health actually looks like. Long wait lists, impossible business models, slow and burdensome administrative processes that ultimately make it so much harder for clinicians to stay in network, harder for providers to stay afloat, and harder for individuals seeking care to actually use the benefits they are paying for. HB 1085 helps move us closer to a system where behavioral health is treated as essential health care, not just an optional add-on. So again, a very personal and massive thank you to the people who organized, testified, shared their stories, and refused to accept the barriers in place, instead seeing a path to create a real and positive change in service of the people that need it. With that, I am grateful to hand it over to Kate Redling.
Thank you, Rose, and thanks so much to Midwest Counseling for hosting us this morning. Thank you to State Rep Lindsay LaPointe and State Senator Karina Villa for making this possible for us to have something to fight for. My name is Kate Lujan Redling. I use she, her pronouns. I am the board chair of the People's Lobby and the founder of our healthcare task force. I'm proud to stand here as a community organizer with providers and patients and legislators because we make up the community that made it possible for this bill to be passed. When implemented, HB 1085 will improve the reimbursement rate for providers so they can actually afford mental health care too, thus increasing capacity for all of us who need care. The People's Lobby is a grassroots, people-based organization that, aside from working in healthcare, organizes to win dignified work for gig drivers, for environmental justice in every corner of Illinois, and fighting for the progressive revenue that it's going to take to win all of the things that we deserve. So this partnership did not start when the bill was introduced. In fact, it started back when, for me, when we interviewed Lindsay LaPointe. She had taken a hard vote and was getting challenged. And we had an opportunity to meet and talk with her, and I was like, this is the one. We fought, we helped protect her and get her reelected. And because of that interview, I knew her background in mental health care. And when I wanted to start the healthcare task force, that was one of the first calls that I made. So when this bill came around, we had an opportunity to organize for winning HB 1085. There was no question. Now, what organizing means is that you don't do it alone, that you look around and see who is already in this work, Thresholds and Heather, Protect Our Care Coalition, all the mental health organizations working on this bill, and we collaborate together. Organizing this to win this bill means that building and maintaining a support system that the people who wanted to fight for it had something to opt into. It meant that we had a system for people to send their letters to their legislators, their state legislators, that we had a way to track it, that we could demonstrate again and again and again how deeply this bill was needed. And so when it came time that the industry would fight back, because that's what it does, we had the receipts. We took dozens and dozens and dozens of people to Springfield to the point where we had legislators say, y'all are everywhere. That's what it takes. We showed up at community meetings with our state legislators to demonstrate how important it was that we get this bill passed. So for partners like Thresholds, Access Living, NAMI, and other members of the Protect Our Care Coalition, we were able to fight together. This is a moment that feels truly urgent in all of the ways. And the only way to meet that moment is with full access to dignified health care and dignified mental health care. Nothing else happens without it. I can't keep going to my job without stable mental health care. I can't keep parenting. I can't take care of myself. This is the foundational work that we must stay organized on. So organizing to win this bill means that we stay in relationship. This was a fight based on relational organizing. We are going to keep fighting for all the things. This was not a one and done. We will maintain these relationships. We will keep showing up in Springfield. We will be rolling deep, and we'll be winning the bills that we choose to fight on next. Thank you so much, and I would like to turn it over to Kristen Holub.
Hello, I'm Kristen Holub, and I'm here today because I know what it's like to need help and not be able to get it. In 2022, my eldest child had an acute mental health emergency. Even though my child was already in therapy and my family had good insurance, there was no care available to us. We had to take them to the ER and pay out of pocket to get them the medication and the care that they needed to stay alive. Even though our whole experience was awful, to say the least, I spent long periods of time on hold over and over, only to be told that the practice isn't taking any new clients or their wait list is estimated to be like a year out. It was crushing, filling out long online intake forms, explaining our situation over and over again, just to be ghosted or receive an automated reply telling us that they couldn't help us. I was so stressed, scared, and worried that I had to put on a brave face for my family, and inside, I didn't know if I'd ever find my team the care that they needed and deserved. I remember thinking as I'd hang up from another 45-minute phone call, why is this so impossible? No one should have to deal with this. Eventually, we settled for a doctor who was not a psychiatrist because we were out of options. Things were still pretty bad, and after a particularly rough Zoom call session, my husband and I decided that we had no choice but to go out of network and pay out of pocket to find a good psychiatrist for our child. We did everything right, and this was still incredibly difficult. I needed to be spending time with my child who was in crisis, not downstairs on the phone with the insurance corporations. That should never have happened. What do people do when they don't have the resources that I had? How do people cope when they don't have endless amounts of time to spend on the phone, money to pay out of pocket for great care, or a supportive network of family and friends? This is why I joined the People's Lobby. I realized that maybe I could do something small to help fix this broken system by uniting with other people who were motivated the same way I was. I found that I could participate in fixing the healthcare system even if I didn't understand the system inside and out. I started by reaching out to elected officials to set up meetings with the People's Lobby members just like me. Within the organized structure of the People's Lobby's team, we worked with Representative Lindsay LaPointe and others to ensure HB 1085 won the support. And I even went down to Springfield with the People's Lobby, met with legislators in person, told my story, and asked them to pass this bill. I got a little emotional, as I am now, when I learned that HB 1085 finally passed. Because what that means is that more mental health practitioners will be fairly compensated in Illinois, allowing more of them to stay in network and therefore be available for There's more work to do, but nobody should have to go through what my family did. Thank you very much. And I'll pass it over to Senator Beal.
I'm going to veer away from my notes just for a second. So, I was a school social worker for 15 years. This story that you just shared, I wish was so unique, but it's not. I had case folders after case folders that had similar stories. So when I became an elected official, no one gives you a folder that says this is how you do it, a binder that says do this. But every time I introduce bills, those same folders, they look very similar to the folders of my students. And every time I would close a case with my students, I would pray over it and then shred it. My bill folders are the same in my heart because I don't just introduce any kind of legislation. So when HB 1085 came, it was one of my kids. One of my kids. And year after year, meeting after meeting, hour after hour, Heather, Sebastian, Lindsay, when we sat across those fancy lobbyists with real expensive, nice clothes on, it was intimidating at times with their big words and their lawyers speak. But those files were my kids' files. And you see, this bill was bigger than me and bigger than LaPointe. This was never our bill. This bill was your bill, the people's bill, the kids' bill. And so basically, we kept getting up to the finish line, and it was about to pass, and then it didn't. And then it happened again, and then it didn't. And so it was going to happen again. But because this bill was not about me, I walked into the Senate President's office because I realized something, that if that bill held my name on it because of some internal politics, the bill was again going to fail. So I took that folder, my kid. I walked into the Senate President's office and I said, Mr. President, please take this bill. If it has my name as chief sponsor, it will not pass. Mr. President, I beg you. And Don Harmon, President of the Senate, took that kid of mine and got it across the finish line, and that's how 1085 passed. We're not done. We are not done. We are just beginning, and I think that the insurance lobby better go buy some more fancy clothes. We're not done with them. So when people can't access behavioral health care because they can't find in-network providers, the crisis doesn't disappear. We all know that. They escalate and they turn into emergencies. And that shifts into our infrastructure, our hospitals, our emergency rooms. And what we need to make sure is that this isn't going to shift the cost in care into Medicaid and other public funded systems, right? Because what we know right now is that this Trump regime is slashing budgets for healthcare and mental health. It's impacting our state, and our state can't bear the burden, right? So we can't shift these costs on to Medicaid. So we have the Preventing Crisis Cost Shifting to Medicaid Act, and this act is about fairness and responsibility. It ensures that private insurance can't collect premiums and then offload the real costs of care onto taxpayers who are already strained in public systems. By holding insurers accountable, we can begin to stabilize our behavioral health workforce, bring providers back into insurance networks, and build a system that works for patients, providers, and communities across our state.
one that therapists feel most acutely is financial. Despite advanced graduate degrees, 3,000 hours of postgraduate training, a formal licensing exam, and ongoing continuing education requirements, we are frequently compensated by insurance companies at 50 to 75% of our living wage rate. And despite skyrocketing costs of living and costs to operate a practice, insurance companies offer insulting raises of $1 to $2 every few years, if anything at all. Being a therapist then becomes a math problem, and therapists hate math. How many people do I need to see a week to keep the lights on and pay for my kids' braces versus how many can I actually see and give good care? I have had to create multiple side hustles for myself, someone with a master's degree, to generate more income and constantly fear an unexpected car repair or medical bill. Taking time off is weighed against losing the income I could be generating during that time, and I am forever running the numbers of client sessions, income, and expenses in my head. When therapy becomes commodified in this way, the quality of our work is impacted and the quality of our lives and our own mental health suffers. Let me be clear. Insurance companies are not gateways to care. They are the gatekeepers of care. In our healthcare system, people like me who are trained in mental health don't ultimately decide what treatment our patients receive. Insurance companies do. Most practice owners I know have to be selective about which insurance plans they take, which often means that many people cannot find a therapist who takes their insurance. Sometimes we have to decide to subsidize what the insurance companies refuse to provide on our own by offering sliding scales or pro bono work beyond what we can actually afford. And when providing access to vital and life-saving mental health care becomes the burden of people around this issue, I let them know that I was fed up with how insurance companies dictate mental health care and took on a role organizing therapists in support of this bill. We organize by 1, sharing information. Insurance companies profit off of keeping providers from accessing support and information. Policies, answers, and customer service are often shrouded in mystery, automated phone menus with no avenue to speak to a live person, and hours-long call times. I built power with my base by sharing information about the bill and making it easy for people to tell their legislators what they needed. 2, gathering stories. I held 4 provider roundtables in the fall of 2025 to hear directly from other therapists how insurance company rates and practices were impacting their ability to accept a range of insurance, see more complex clients, and have financial sustainability. Clear narratives emerged that painted a story of therapists struggling to make ends meet and clients unable to find care, and these themes and stories were used in meetings with elected officials to garner support, such as Don Harmon. Number 3, becoming loud and visible. Building real power with therapists for healthcare reform has required us to confront something uncomfortable. The way we've been trained to exist in the background. So many of us were socialized into self-sacrifice as a virtue, into scarcity as a given, into a weaponized version of compassion that tells us good helpers don't ask for more, don't take up space, and don't make noise. We're taught to absorb harm quietly, to manage around broken systems instead of changing them, and to mistake endurance for integrity. But that posture has never protected our clients, and it has certainly never protected us. To build power, we had to set that conditioning down. We had to get visible, we had to get loud, we had to risk being seen as too much in a system that depends on our silence. Collective change doesn't come from individual martyrdom. It comes from solidarity, from naming what isn't working, and from refusing to confuse compliance with care. By passing this legislation, the patients and providers you see here have directly increased access to care in Illinois. If therapists are being paid more by insurance companies across the board, more therapists will be willing to take more insurances. If private insurances are paying at a higher rate, more therapists may be able to take Medicaid and Medicare. If it becomes more sustainable to make a steady living that reflects our advanced degrees and professional expertise, more people will enter or remain in the field. All of these things will enable more people to attend therapy while supporting the quality of life of the humans giving the care. Additionally, this rate increase has prevent therapists from partnering with predatory venture capitalist mental health companies, and send the message that therapists deserve to be paid like the health professionals we are, so that we can do things like pay our mortgages, tackle our student loans, and afford to go to our own therapy. I wish that was a joke. This bill wins us a much-needed raise for certain insurance plans, but for me and many of my colleagues, it demonstrates something more, our power. It's in our best interest and the best interest of the people we serve for therapists to stand up to the profit-seeking corporations that get in the way of us providing care. Victories like this allow us to think big and keep working toward a system where patients and providers can focus on care and healing rather than spending all of our energy fighting insurers to get the bare minimum scraps. Insurance corporations depend on us being quiet, disorganized, isolated, and fearful. But this victory proves that when we organize together, we send a message that is a demand for accountability, a demand for respect, and a demand for them to do their jobs. When we fight, we win. Yeah! Jason Anua.
Good morning.
Good morning.
My name is Dr. Jason Anua. I'm a general psychiatrist based here in Chicago, Illinois. 2 years ago, I started a practice with one of my colleagues from residency, Dr. Sarah Lapierre, called Woven Clinics. We started this practice with the idea that we wanted to focus on community-based psychiatry and increase access to care. When I was in medical school, I was also working on my master's in public health. I was doing community-based work, and I remember one of my mentors saying that the work that you do with your patients doesn't stop at the bedside. It doesn't stop in the clinic. It is adding your voice where the voice of our patients can't be heard. So when I was asked to join this press conference to speak about this bill, I was humbled. I've learned over the years that psychiatry is a humbling experience. It's both a practice in humility and humility in practice. I found in conversations working in the emergency department a repeating motif. We tried. We tried to find care. A mother, a father, a son, a grandparent, unable to access their medication. When we started our practice, I thought that after all the years of education and training, I might know a little bit of what I'm doing. But the insurance companies taught me that there was another degree to gain. That to learn to navigate that system was built in a way that wasn't meant to be navigated. That if I struggled to navigate that, then the patients that I serve would have the same problem, if not greater. So I just came to say thank you for the work that you all have done. This is the beginning, and I can't wait to continue to help move this legislation and everything forward. Up next, Representative.
Good morning, everyone.
Good morning.
Wow. This is what happens when you have social workers, more social workers, parents, psychiatrists, community members that urgently need behavioral health care all working together on a transformational bill. And with the words that have been shared this morning, I am just so grateful. And I already have deep feelings about this bill and what's to come. But the curtain was just pulled back on how meaningful it is. So thank you to everybody who has spoke already. As many of you know, I'm 19th District State Representative Lindsay LaPointe, and I am a social worker turned legislator, just like State Senator Karina Villa. And we both prioritize affordable and accessible behavioral health support for everyone. For everyone. When we talk about behavioral health
addiction support, recovery, trauma support, and harm reduction. Those are the things that all of us will need throughout our lifespan. As state rep, I'm especially proud to officially represent thousands of licensed clinicians on the far northwest side, including Allison, who you've heard from. I'm also grateful to officially represent many parents who struggle to access behavioral health support for their kids and then who speak up, like Kristen, also a resident of the far northwest side. I have to say again for the record that HB 1085 would not have passed without many of the people in the room. That includes Senate President Dawn Harmon. Far and away, that includes Heather O'Donnell, who's standing in the back. It includes Matt O'Shea, who's not here. It includes Thresholds, and Amber, thank you for your work at Thresholds, too. We trust your leadership. So we've heard about the organizing for this bill, which took 3 years of persistence, and that persistence signaled to the insurance lobby in Springfield that we were not going away. So it was what we call a hard bill, but I will tell you that many of the conversations with legislators were actually easy. And they were easy because legislators are humans too. They immediately understood it because they've lived it. I had one colleague who shared that she has paid out of pocket for her son's psychiatric care for years because the psychiatrist that worked for them didn't take her insurance. I had another colleague that shared through tears when she realized that she wouldn't have to take her son to a therapist and a psychiatrist on a different day, that she could do it on the same day because of this bill and save so much time. She was an automatic yes. And it was an aha moment where she realized this is going to impact her life. No doubt HB 1085 is one of the most meaningful, if not the most meaningful, mental health bill that we have passed in the last few years. And it's so meaningful because it cuts to the heart of the two biggest barriers to behavioral health care access. And one of those things is the endemically low reimbursement rates that keep providers out of insurance networks or keep providers out of the profession altogether. That is a theme of mental health care. Whereas with physical health care, it is far better compensated and therefore far more available. So that is one of the biggest barriers. The second biggest barrier is the excessive red tape that you've heard about today. It creates an administrative burden that keeps providers from taking insurance, private insurance and Medicaid. And with Medicaid, it's really bad. The red tape is really bad. Many in this room know that. HB 1085 breaks these barriers by holding private insurers accountable to cover what we already pay for with our monthly premiums by raising the reimbursement rates and cutting the red tape. And if you take a moment, as many of you do because it's your work, to look around at other meaningful mental health policies, you see those same themes. We had the Healthcare Protection Act in the spring of 24 and the spring of 25, and that got